How much will Medicare cost you in 2026? Short answer, it depends. Let's talk about it. Medicare Part A is going to have a zero premium attached to it for most people if they have met Medicare's criteria of either 10 years or working 40 quarters. Medicare Part B for most people is going to be 202.90, and that's either going to come out of their Social Security check if they go on Social Security, or if they're on Social Security at the time of Medicare, or they will be billed quarterly if they choose not to take their Social Security at the time of going on Medicare. Your cost also is going to mainly depend on which one of the main two Medicare options that you take. Option number one is you stay on original Medicare and you get what's known as a Medicare supplement, also known as a Medigap plan. The most popular one across the country is the Plan G. Then you have to get a Part D plan to help cover your prescriptions. And even if you take hardly any prescriptions or no prescriptions at all, you want to get on a Part D plan when you go on Medicare, or Medicare will penalize you for the rest of your life. Now, your Medicare supplement plan and your Part D plan is going to ultimately depend, the cost that is going to ultimately depend on where you live in the country. And then for your Part D plan, what type of medicines you're currently taking. The other thing that's going to factor into your cost is what type of ancillary plans that you will need to address additional healthcare concerns, such as dental, vision, and hearing, cancer, heart attack, and stroke plans, and more. Option number two is you go on what's known as a Part C plan or a Medicare Advantage plan. And most of those plans, depending on where you live throughout the country, are either going to be very low premiums or have no premium attached to it. But just like option one, there are some gaps that need to be filled that comes with the Medicare Advantage plan. More specifically, the bigger copays that you're responsible for being on those plans. So one of the main ancillary plans that we recommend that you get if you go with option two is to get what's known as a hospital indemnity plan to protect you against those major copays. For free Medicare help and my free Medicare guide, click on the Learn More button below. And as always, make sure to follow us to stay up to date on all things Medicare.